An anxiety disorder is a mental health condition where a person experiences intense fear or worry in response to certain things or situations. This can also cause physical symptoms like a racing heart and sweating. While feeling anxious sometimes is normal, like before a big presentation, job interview, or important decision, an anxiety disorder is more severe. It occurs when anxiety disrupts your daily life. Your reactions are much stronger than the situation warrants. You can't control how you respond to stress. According to the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is the standard reference for diagnosing mental health conditions, there are several types of anxiety disorders. Generalized Anxiety Disorder, GAD. This condition involves persistent and excessive worry about everyday issues, such as work, health, or daily tasks. People with GAD often feel overwhelmed by their anxiety and struggle to control their worries, even when there is no immediate cause for concern. Agoraphobia. Individuals with agoraphobia experience intense fear of situations where they might feel trapped or unable to get help. This can lead them to avoid places like crowded areas, open spaces, or even leaving their home. Out of fear, they won't be able to escape or receive assistance. Panic disorder. This disorder is marked by recurrent and unexpected panic attacks, intense periods of fear or discomfort that come on suddenly and without clear reason. These attacks can be accompanied by physical symptoms such as heart palpitations, sweating, and trembling. Some people with panic disorder may also develop agoraphobia. Specific phobias. These involve intense and irrational fears of specific objects or situations that significantly disrupt daily life. There are many types of phobias, each related to different fears, such as heights, spiders, or flying. The diagnosis for these fears is generally classified under specific phobia, except for agoraphobia, which is considered separately. Social anxiety disorder, also known as social phobia. This condition involves extreme fear of being judged or scrutinized by others in social or performance situations. This fear can make everyday activities like speaking in public or attending social gatherings highly stressful. Separation anxiety disorder. This disorder involves excessive anxiety about being separated from a loved one, such as a caregiver. While it's normal for young children to experience separation anxiety, when this fear extends into older children or adults and impacts their daily life, it may be classified as separation anxiety disorder. Selective mutism. Typically affecting young children, selective mutism is characterized by an inability to speak in certain situations or settings, despite having the ability to speak in other contexts. This condition can also affect adolescents and adults and is driven by severe anxiety. Other conditions, such as post-traumatic stress disorder, PTSD, acute stress disorder, and obsessive-compulsive disorder, OCD, share some characteristics with anxiety disorders, but are classified as separate conditions by the American Psychiatric Association. Symptoms of anxiety disorders can differ based on the type, but they generally fall into psychological and physical categories. Psychological symptoms may include intense feelings of panic, fear, or dread, persistent unease or irritability, uncontrolled obsessive thoughts, difficulty focusing. Physical symptoms might involve restlessness or being easily startled, rapid heartbeat, palpitations, trouble breathing, shortness of breath, muscle tension, cold or sweaty hands, dry mouth, nausea or feeling sick to your stomach, numbness or tingling in your extremities, trouble falling or staying asleep, insomnia. If you often experience these symptoms, it's important to consult with a healthcare provider or mental health professional for support and treatment options. Understanding the causes of anxiety disorders involves examining multiple factors. Chemical imbalances. Anxiety disorders are linked to imbalances in brain chemicals called neurotransmitters. Norepinephrine, serotonin, dopamine, and GABA, gamma-aminobutyric acid, are crucial in regulating mood and anxiety levels. Disruptions in these chemicals can lead to heightened anxiety and stress. Brain changes. The amygdala, a part of the brain involved in processing emotions, plays a significant role in anxiety. Research shows that individuals with anxiety disorders often have heightened activity in the amygdala, particularly when they encounter stress or anxiety-inducing situations. Genetics. Anxiety disorders frequently occur within families, suggesting a genetic component. Studies indicate that if a close relative, such as a parent or sibling, has an anxiety disorder, your risk of developing one is higher. Specific genes related to the regulation of stress and anxiety might be involved. Environmental factors. Prolonged exposure to stress can disrupt the balance of neurotransmitters that regulate mood. Chronic stressors, such as ongoing financial difficulties or relationship problems, can trigger or exacerbate anxiety disorders. Additionally, experiencing traumatic events, such as abuse or a natural disaster, can be a significant trigger for anxiety disorders. Diagnosing anxiety disorders involves several steps. Medical evaluation. Your healthcare provider will start with a comprehensive evaluation, including a physical exam and questions about your medical history, medications, and family health. This helps rule out physical conditions that might mimic anxiety symptoms, such as thyroid disorders or heart conditions. Mental health assessment. If no physical causes are identified, you may be referred to a mental health professional, such as a psychologist or psychiatrist. They will conduct a detailed interview to assess your symptoms, including their intensity, duration, and impact on your daily life. They may use standardized tools and questionnaires to evaluate your mental state and diagnose the disorder according to the DSM-5 criteria. Exclusion of other conditions. Although there are no specific tests for anxiety disorders, providers may use blood tests or imaging scans to rule out other conditions that could cause similar symptoms, like hyperthyroidism or neurological issues. Anxiety disorders require a comprehensive treatment plan, which may include medication, psychotherapy, or a combination of both. Medications can help manage symptoms but are not a cure. Types include antidepressants. These are often prescribed for anxiety and include selective serotonin reuptake inhibitors, SSRIs, like sertraline and escitalopram, and serotonin norepinephrine reuptake inhibitors, SNRIs, like venlafaxine and duloxetine. These medications help balance brain chemicals to improve mood and reduce anxiety. They might take several weeks to show effects. Benzodiazepines. These drugs, such as alprazolam, clonazepam, diazepam, and lorazepam, work quickly to reduce anxiety, but are generally used short-term due to risks of tolerance and dependency. They are often prescribed for acute anxiety or panic attacks. Beta blockers. Medications like propranolol help manage physical symptoms of anxiety, such as rapid heartbeat and tremors. They do not address the psychological aspects of anxiety, but can be useful for situational anxiety, such as performance anxiety. Psychotherapy helps address the underlying issues of anxiety and includes cognitive behavioral therapy, CBT. CBT is the most widely used therapy for anxiety disorders. It involves identifying and changing negative thought patterns and behaviors that contribute to anxiety. CBT helps you develop coping strategies and problem-solving skills to manage anxiety effectively. Exposure therapy. This technique involves gradually and systematically exposing you to feared situations or objects in a controlled environment. The goal is to reduce the fear response over time by helping you confront and manage your fears in a safe setting. Your healthcare provider will work with you to develop a tailored treatment plan based on your specific needs and preferences. Regular follow-up appointments will help adjust the treatment plan as needed to ensure optimal management of your anxiety disorder. Managing an anxiety disorder effectively often involves combining professional treatment with personal strategies. Here are some practical steps you can take. Stress management. High levels of stress can exacerbate anxiety disorders. To manage stress, try techniques like meditation, deep breathing exercises, and mindfulness practices. Engaging in regular physical activity such as walking, jogging, or yoga can also help reduce stress levels and improve overall well-being. Support groups. Joining a support group, whether in person or online, can be highly beneficial. These groups offer a safe space to connect with others who understand what you're going through. Sharing experiences and learning new coping strategies from people with similar challenges can provide emotional support and practical advice. Education. Gaining knowledge about your anxiety disorder can empower you and improve your ability to manage it. Educate yourself about the condition through reputable sources and consider sharing this information with family and friends. This can help them understand your experiences better and offer more effective support. Limiting or avoiding caffeine. Caffeine can aggravate the physical symptoms of anxiety, such as rapid heartbeat and jitteriness. Reducing your intake or avoiding caffeine altogether may help alleviate some of these symptoms. If you're unsure how much caffeine is right for you, Consult with your healthcare provider for personalized advice. Incorporating these strategies into your daily life, alongside professional treatment, can significantly enhance your ability to manage anxiety disorders. By addressing stress, connecting with others, educating yourself, and moderating caffeine intake, you create a supportive environment that complements your treatment plan. Each step you take contributes to a more comprehensive approach to managing anxiety and improving your overall quality of life.